Um, Welcome back again. My name is Srinivasa Madanilili. I want to continue on the progress that has been made in the health. Okay, so we talked about the life expectancy, child mortality rate, or infant mortality rate, and maternal mortality rate. How the whole world has made progress in those areas. So now let's continue in some other key areas. So one of the uh, greatest achievement in the last 100 years is eliminating the smallpox. So it's it's unbelievable to know that between 1900 and 1979 it killed 300 million people, more than any other causes in the world. Okay, so it's unbelievable. You can check this data. I'm not trying to exaggerate. If there is something wrong, I will admit it, but more, so this is based on the kind of research I've done. This is credible data. Okay, so uh, with all the kind of advancements in the science, technology, and the economy, and administrative setup, international cooperation, etc., we are able to eliminate smallpox. In fact, it's smallpox virus is there only in the in two labs. They're just there for research purpose. Otherwise, it's completely eradicated, and we have stopped this massive killer. So that's unbelievable progress. So one of the key thing that to know about it, there were inoculation practice in India. It is called also called variolation in China. Essentially, in case of India, so the small portion of the infected, the skin was kind of injected into to the healthy people to create that resistance in those healthy people. Similarly, dried up skin cells of this infected people. There would be pus coming out of these infected people in various. There would be kind of some kind of uh, bubbles that would come up on the bodies, and in those there would be pus, and that from that they would dry up the skin and this one, and they would be that dried up skin would be blown into people's nose as a kind of preventive mechanism. This was practiced in China, and similarly, as I said, in case of India, the pus coming out of these bubbles would be injected into healthy people. A tiny portion, a small portion of it, to develop the resistance. So Edward Jenner, English, I think is an English biologist, so he took this idea and took next level and developed the vaccine. So with this advancement and proven technique, and also kind of producing these vaccines at large scale and distributing it, administering it, and so that we are able to eliminate the smallpox. So this is really really huge positive thing. People have really forgotten about it, how deadly this was. As you can see, some of the literature on this, this one. So um, this is the most significant milestone in global public health. And it would its mortality rate was so high it would kill 1 in 3 people infected, often more in the most severest forms of the disease, right? um, as I said, this variolation or inoculations were in practice in India and China. I think most likely that was not widely administered. It was not widely, I mean, kind of very well understood, but that was kind of practiced in isolation, in some places, and so it was able they were able to kind of manage or contain it to some extent with the kind of advancement of the taking that idea to developing the vaccine and making it available and administering safely. We are able to eliminate a small. So let's look at the another infectious disease that surfaced in late 70s and early 80s. In fact, I was one of the person. I was in my teens, and when I had read about HIV/AIDS in 1980s, I was really scared because it can spread through bodily fluids, through saliva, through blood, through the sexual intercourse, etc. So it could easily spread when people share the needles, used for injections, and also razors, razor blades that would be shared. So if you go back to 1980s, the most of the time we didn't have the disposable syringes and needles back then. People would use the reuse the needles. They would boil the needles and they would reuse the syringes. So many a times that boiling and sterilizing would not be adequate, because it requires considerable of the amount of energy and time, and it may not have been we may not have been able to kind of sterilize very well. But luckily by 90s, this very cheap and affordable reusable syringes were developed and made available. In fact, they were given free in 90s and 2000s. Okay, so that cut down the things, and then one of the other thing that I was really concerned about, in India, most of the people would go to barbers and they would reuse the razor blades. Okay, so that would be a scary thing. People there could be accidental cuts, and that could spread the AIDS as well. And then you know that people have sometimes many times unsafe sex. People go from place to place and they have sex with the strangers, for whatever the reasons, and they could say the AIDS could spread, right? So with that, I was really scared. India could face severe issues. Luckily, one, because of the preventive things that happened with the disposable syringes and disposable razor blades, and the education and awareness, plus the awareness about the safe sex and the condoms and etc. And also, we are able to understand this disease better, and we are able to manage it. Many people got infected, but they didn't die of HIV infection, and that did not translate to AIDS. That many people lived life very near normal for many years, sometimes many decades. You can see that, so the deaths were very high in Africa, and nearly 50% of the deaths were happening because of the AIDS in the mid 90s. So it has dropped to nearly 10 to 15% in Africa, and in India it has dropped significantly as well. So, but still 10 to 15% of the deaths happen in Africa are happening because of the AIDS, but the trend is going down, which is a positive. So again, this is a major achievement because of the kind of various efforts of various agencies, international and national agencies, and general public at large. And if you look at the same thing in HIV and AIDS in India, you can see that it peaked. Infections is peaked in the mid 90s, around 250,000, and since then it has been decreasing. You can see the green bars here. So it is less than 100,000 infections as of now. In fact, the deaths peaked around 2005, and then they were decreasing significantly since then. Okay, so roughly still 50,000 plus deaths happen because of AIDS, but if you look at larger scheme of things, it's significantly small. Okay. As I said earlier, the key points that things that contributed to containment are education, awareness, prevention, and treatment options, and access and affordability. Okay, so in fact, a lot of there are no cure for it, but there are the medicines have been kind of medicine protocols have been developed to kind of manage it better. Okay, so a lot of these drugs actually were manufactured or manufactured in India and made them affordable, and they're provided at very affordable prices to Africa. Though India kind of violated the IP, the copyrights and intellectual property of the medicines, but it was done with a good intent, and it was actually the one of the medicinal diplomacy that has been happening by India for the last 25 years or so. Because people talk about the vaccine diplomacy, but before the vaccine diplomacy, we've been doing this medicinal diplomacy for last 30 years. CIPLA leads that medicine diplomacy. Another major area of improvement is seasonal flu used to be quite frequent and also quite deadly as well. The last major major flu was Spanish flu, apart from the COVID-19. So we'll talk about the COVID. You know that COVID-19, nearly 20 million people have died in. Am I correct? I think 10 or 20 million. I'll have to recheck it. But irrespective, it killed at least 10 million people around the world. Okay? So China numbers are unknown, and Indian numbers are significantly under reported as well. And you can see that in 1980, 89, 90, roughly about 3 to 5 million died of the Russian flu. And the Spanish flu that happened after World War One, 19 between 1918 and 1920, it killed anywhere from 50 million to 100 million. The estimations are very significantly. So there's a challenge with the data. But even if we take the lower end of it, it could be anywhere from, there are various estimations. Minimum estimation is 17 million, and the maximum estimation is 100 million. So if you take the average of this, anywhere from 30 to 50 million people would have died in this. In fact, I lost my maternal great grandpa parents in this. I think if you ask great grandfathers, they would tell that how many people they would have lost. So in this Spanish flu. And the story goes that there would not be people to lift the bodies. That is the kind of level of deaths that would happen in this flu. There are various flus have happened, since then, but number of deaths have kind of come down, and because they're able to manage them. As you can see, the flus have increased, but the thing we're able to contain or manage them fairly well with the fewer fatalities. So with that, I think the key conclusions, so that we have significantly increased the life expectancy from 40 years to 70 plus years, etc. And we have significantly cut down the child and maternal mortality rate, and deadly infectious diseases, smallpox have been eliminated, and the TB has been contained, and we are able to manage TB, and also the flu's severance of the severity of flu incidences have been contained as well. HIV we are able to contain, etc. So these are all major achievements that would not have happened if there were no scientific, technological, and administrative and economic progress that have happened in the last 100 years or so globally. It is not just in India, right? As I said, it takes science, education, administration, government policies, community involvement, NGOs, and entrepreneurs to make all this happen. So it's a confluence of all those things. It's not just because of the hospitals and medicines alone. Okay? And it's also because of the advancement in various industries. If you're not able to, kind of produce reusable syringes, not reusable, disposable syringes very cost effectively, would not be able to manage the or contain the AIDS so easy, right? So it's a advancement in various industries. In fact, all of the industries, sectors, services, and more, right? So and also unless we had good nutritional food available for vast majority of the public, we would not be able to achieve this thing, whether it's the life expectancy or other things. I mean, most of the infectious diseases people would suffer because they didn't have sufficient immunity, and they would collapse with and also the improvements in transportation, communication, trade, energy, education, and urban planning, and sanitation, etc. All they have contributed. Right? For all these things, for any of these things, quality and timely data played pivotal role in all of this. Unless you know where the problems is, what the size of it, what the trends are, we would not be able to create policies, programs, or execute those programs, or the actions, right? And also review those the programs and actions, right? So for all that we needed data, and we reasonably got data through sensors, surveys, and whatnot, right? And then in the last 30, 40 years, the computers have revolutionized, computers, internet, and now the mobile phones in the last 10 to 15 years, they've really revolutionized various aspects of the access to data and access to services and access to information, etc. Right? So I think we should really be proud about this advance and the progress that we have made globally and also in India. So with that, I think I'll pause this for a moment. I mean, for this video. So we'll continue about the challenges in the subsequent videos. I think overall, we should really feel positive about the progress that has been made. So we should be really hopeful. As I said earlier, we should not be just stopping there. So because even one small pandemic can upset the whole thing, just like HIV, COVID-19. Okay. So with that, thank you. So we'll continue in the next video.